Why do doctors overlook raw mental health issues? Imagine living with rheumatoid arthritis and feeling constant pain and fatigue. It's easy to focus on those physical symptoms, but mental health often gets left behind. Many doctors tend to prioritize controlling joint inflammation and preventing damage because that's what's most visible and measurable. They see the swelling, the stiffness, and the joint damage, so their attention naturally goes there. But mental health issues like depression and anxiety are just as common in people with rheumatoid arthritis. Studies show that up to half of raw patients may experience depression at some point, and anxiety is also quite prevalent. These emotional struggles can make managing the disease even harder, but they often go unnoticed or untreated. One reason for this oversight is that routine screening for mental health problems isn't always part of standard care. While there are validated tools to detect depression and anxiety, many clinics don't use them regularly. Time constraints during appointments, lack of training for rheumatologists in mental health, and limited access to mental health specialists can all play a role. Rheumatologists are trained to focus on physical symptoms, and they might not feel confident or equipped to address emotional concerns without additional support. Another challenge is how mental health symptoms are interpreted. For example, anxiety symptoms can sometimes be mistaken for physical symptoms of raw like fatigue or pain. Conversely, depression might be overlooked because it can present as just feeling tired or withdrawn, which can also be attributed to the physical illness. Patient reports of emotional distress might be dismissed or misunderstood, especially if patients are hesitant to share their feelings. The relationship between rheumatoid arthritis and mental health is complex and bidirectional. Chronic inflammation in raw can influence brain chemistry, increasing the risk of depression and anxiety. At the same time, poor mental health can worsen raw symptoms by amplifying pain perception, causing fatigue, and reducing motivation to stick with treatments. This interplay makes it clear that treating raw effectively requires attention to both physical and emotional health, but many healthcare systems haven't fully integrated this approach yet. Systemic barriers also contribute to the problem. There's often limited collaboration between rheumatologists and mental health professionals, and guidelines for mental health screening in adult raw care are still developing. Patients might also feel reluctant to discuss emotional struggles due to stigma or fear of being seen as weak. All these factors can lead to mental health issues being overlooked or underaddressed. Addressing this gap is crucial because untreated depression and anxiety can lead to worse disease activity, poorer response to treatments, and a lower quality of life. Incorporating routine mental health screening, educating both patients and providers about emotional risks, and fostering open conversations can make a big difference. Encouraging patients to share how they feel emotionally during visits and providing access to psychological support can help them cope better. In the end, understanding that mental health is a vital part of managing rheumatoid arthritis is key. While physical symptoms are easier to see and measure, emotional well-being is equally important for overall health. Healthcare providers should aim for a holistic approach that includes mental health care, ensuring patients receive the support they need to live well with raw. Always remember to consult healthcare professionals for personalized advice and treatment options tailored to your unique experience.